All right, let's get into it. Today, we're going to take a deep dive inside the cardiovascular system. We're going to follow this incredible chain reaction, this cascade of events in cardiac disease that can start with something that seems pretty simple, like high blood pressure, and wind up in a full-blown crisis. Let's trace that path together. So, how does that even happen? It's a really powerful question, right? How can a simple, routine checkup suddenly turn into this life or death situation? Well, the answer is all about learning to read the clues, the subtle signals our bodies are sending us long before things go wrong. We're going to tackle this like we're investigators, piecing together the evidence from the very first hint of trouble. Okay, so our investigation kicks off right here with those very first clues. The heart doesn't just exist on its own. Its health, or lack of it, shows up all over the body. So let's see how a good head-to-toe check can start to tell us what's really going on with the body's most important pump. So you gotta think of a cardiac assessment like some serious detective work. It's not just about one single clue, right? It's about putting together a whole case file. The vital signs, your heart rate, blood pressure, they give you the raw data. But then you layer on observation, like skin color or how someone's breathing, and from there it gets more hands-on. Inspecting for things like swollen veins, feeling for pulses, and of course, listening to the heart itself. Each piece is a clue that helps build the full picture. All right, so where does all this trouble start? Well, you'd be surprised. It's usually not some big, dramatic event. It starts quietly with these silent troublemakers. These are conditions that can build up for years, sometimes decades, without you feeling a single thing, all while they're setting the stage for a major problem down the road. And the number one culprit, the most common one you'll see, is hypertension, high blood pressure. You've probably heard it called the silent killer, and that's for a really good reason. You almost never feel it. But on the inside, that constant extra pressure is hammering away at your arteries, causing damage. This is the primary driver for pretty much everything that comes next. And here's what's happening inside those arteries. Picture them like brand new, smooth pipes. That high blood pressure injures the delicate inner lining. And once it's damaged, well, it's like a sticky patch where cholesterol and fats start to grab on, forming what's called a fatty streak. Over time, that streak builds and hardens into a plaque, making the pipe narrower and narrower. But the real moment of danger, that's when the plaque breaks open or ruptures. The body rushes to fix it by forming a clot, and that clot can suddenly slam the whole pipe shut. Now, before that pipe gets totally 100% blocked, the heart usually tries to send out a distress signal, a warning cry. And that warning is called angina. It's what happens when that narrowed artery just can't get enough oxygen-rich blood to the heart muscle, especially when you're exerting yourself. This isn't a heart attack just yet, but believe me, it is a flashing red light on the dashboard, screaming that supply is not meeting demand. And this is when things get really serious. We're moving from a warning sign to a full-blown, life-threatening emergency. This is the moment that clot finally seals off the artery and blood flow grinds to a halt. This is the acute crisis. So when we talk about a heart attack, what we call a myocardial infarction, it's not just one thing. There are two main types you'll hear about, STEMI and NSTEMI. A STEMI is the big one. That's a complete blockage, and it causes a very specific, very clear signal on an ECG. An NSTEMI means the artery is only partially blocked, but it's still blocked enough to cause heart muscle to die. When that muscle dies, it releases a protein called troponin, which shows up in a blood test. No matter which one it is, both are absolute medical emergencies. Okay, if you remember one single thing from this entire discussion about heart attacks, it has to be this phrase, time is muscle. Seriously, every single minute that an artery is blocked, more of the heart muscle is literally dying, and that damage, it's permanent. The speed of the response isn't just important, it determines everything about that person's future. So you have to act fast, and I mean fast. The whole goal is just one thing, get that blood flowing again. And it's an all-out assault. You give oxygen to help the struggling muscle, nitroglycerin to try and widen the blood vessels, aspirin to stop the clot from getting any bigger. But the real game changers are the treatments that either physically go in and prop the artery open with a stent or use powerful drugs to dissolve the clot completely. Okay, so the immediate crisis is over. The patient survived. But, and this is a big but, the story isn't over, not by a long shot. Now we're in the aftermath. The heart is permanently scarred and weakened, and it's left trying to do its job under incredible strain. And that leftover strain, it often leads to a condition called heart failure. Now, I know what that sounds like, but the name is a little misleading.
The heart hasn't actually stopped working, it's failed to work efficiently. Because some of its muscle is now damaged scar tissue, it's just weaker. It can't pump hard enough to keep up with what the body needs. It's become a tired, overstretched, and inefficient pump.
And where you see the symptoms really depends on which side of the heart took the biggest hit. It's actually pretty straightforward. If it's the left side that's failing, the blood can't get pumped out to the body, so it backs up where it just came from, the lungs. Just think L for left and L for lungs. That's why you get shortness of breath. If the right side fails, blood backs up in the veins all over the rest of the body, causing things like swollen legs and a swollen abdomen. So how do we know for sure? How do we confirm it? Well, we look for the proof. It's like putting the puzzle pieces together. An echocardiogram gives us a live video of that weak, struggling heart pump. A special blood test called an NT-proBNP shows the chemical signature of a heart under extreme strain. And a simple chest x-ray can literally show us the fluid that's backed up into the lungs. It's a clear-cut case. And that brings us to our final chapter. Heart failure isn't something you cure. It's a chronic condition you manage. So the focus shifts away from crisis intervention and towards the long haul. It's all about finding a way to live a full life, but with a heart that's been changed forever. So managing it for the long haul really comes down to these 4 pillars. And look, they all matter. Medication is absolutely the foundation. Drugs that make it easier for the heart to pump and get rid of excess fluid. But right behind that are massive lifestyle changes. And it's not just about taking pills. It's about becoming an active partner in your own care, monitoring yourself daily, and really understanding your condition. So as we wrap all of this up, what's the big takeaway? It's that this whole cascade, from start to finish, is a chain of events. And at every single step along the way, from catching high blood pressure early, to recognizing angina, to getting help fast during a heart attack, acting quickly and decisively changes everything. Early recognition and timely intervention are what turn this story from a tragedy into a manageable journey. So I want to leave you with this question. Now that you've seen how this all connects, how a silent problem can lead to a crisis and then to a chronic condition, now that you have that knowledge, what's one single change you can make for yourself or for someone you care about to interrupt this cascade and build better heart health?